Medical details released today about Senate Minority Leader Mitch McConnell. We're now learning, according to doctors, that he did not suffer a stroke or a seizure when he froze in front of those television cameras last week. This was the second time in 2 months that viewers saw this.
That's okay. What are your thoughts on running for re-election in 2026?
What are my thoughts about what?
Running for re-election in 2026?
That's
And that pause went on for quite some time. Here to talk about this, Dr. Todd Ellerin, Vice Chair of Medicine at South Shore Health. Good to see you, Doctor.
Hey, Dr. T, it's great to see you. So obviously there's been a lot of concern about the senator's health. We now know, and as Maria just said, the Capitol Staff physician ordered a number of tests following the incident last week. What, as a professional, what do the results show you?
Well, Eddie, first of all, I think it's good news that it sounds like his MRI was normal. Of course, I didn't see it, but that really excludes things like strokes and tumors. So, that's very good news. Now, it doesn't exclude seizures as a possibility. It's still possible that he had focal seizures. I will tell you, when I look at the videos of both instances, they really do look like focal seizures to me. But again, I can't make that diagnosis. It's possible that it could be other things as well. Arrhythmias can lead to these staring spells. Oh. And then let's talk about the concussion from a months back. Can a concussion do this? There's something called post-concussive syndrome, which can lead to behavioral changes, headaches, really slowing. These type of prolonged staring spells would be very unusual for that. You can be a little slow, but I think that would be unusual for that as well. So I think, to me, we still don't know the answer, and I don't know the answer, right. But I think seizures, focal seizures, are still on the differential.
So let's take a deeper dive into that concussion incident that you mentioned. As you know, there are a lot of theories out there about the senator's medical condition. He's 81 years old. His office did confirm he had at least 3 falls this year, including one back in March that left him with that concussion and broken ribs. Do you think that it's possible these separate events could be related?
I think it is possible, Maria. One question I have is that first fall, was it a fall that led to a concussion, or was this a similar problem that we're seeing now? Did that actually lead to the fall? So I think, again, in this situation, I think there may be more questions than answers. But a concussion, most concussions resolve within a couple of weeks. Post-concussive syndrome is a syndrome, as I described, behavioral changes, cognition. You can think of memory problems, personality problems, and really a generalized slowing. Could his spells be part of a post-concussive syndrome? I doubt it. Again, I'm not a neurologist, and he has an excellent medical team. Right. But I do think one thing to be clear, to clarify, an EEG which detects seizures, when you're in between seizure activity, what we call interictal period, you can be seizure-free but still have seizures. So again, I really think by looking at this, that would be highest on the list for my differential.
So Dr. T, a couple of reminders for our viewers at home. You don't treat Senator McConnell. He's not your patient. He does not receive care at South Shore. So let's just put that right on the table. But you are a doctor, and you know what you're looking at here. What is your advice if he experiences? I mean, he had one a couple of weeks ago. We had one about a week or so ago. So there've been a number of them in a relatively short period of time. What if similar symptoms appear in the future?
Yeah. Well, I told you earlier that by looking at these, if I had to say what's the most likely, I would put focal seizures as the most likely, but I don't know the answer. Other things I mentioned would be arrhythmias. That's possible. So if he had another episode like this, obviously his medical team decides whether he has to go to the hospital, whether he has to go to an emergency room. But I think most importantly, you want to make sure your specialists are involved, the neurologist, the cardiologist. And if it happens again and everything else is normal, I really would ask the question, has he had a prolonged EEG, not a short-term like 24-hour, but like a 72-hour one? And then if that was normal again, I would ask the question, if I were the patient, should I be put on an anti-seizure medication to at least see if that's going to help? Again, you wouldn't do that lightly. You don't want to just put someone on a medication when you don't know the answer. You could be masking something else. So those would be the type of things. I think specialty care is most important, and hopefully this doesn't happen to him again.
All right, Dr. Todd Ellerin, thank you so much. As always, Doctor, be well.